Dr. Khadija Mohammed and Shagufta from AKU Karachi regarding the oral abstract session, Best of AMSTRO. This is the last one. And I think we should be sitting here to encourage these young speakers. Thank you.
Assalamu alaikum, everybody, and thank you for everybody staying that late. So I think our young radiation oncologists, they deserve, even the last moment, they still deserve that. So we will start with Yumna. Yumna Ali, she's a radiation oncologist from Pakistan.
So good evening, everyone. On behalf of my team, I'm very grateful to the Scientific Committee of AMSTRO for giving me an opportunity to present my work in this inaugural session of AMSTRO. So our study is about the impact of simulation video education in radiotherapy. No disclosures from my side. As we all know, that radiation therapy is an important component in the treatment of cancer patients, and more than 50% of the patients must receive radiation therapy during some point of time during the course of their treatment. So these patients, after the trauma of word cancer or after coping up with the chemotherapy or surgery, when landed up into the radiation oncology clinic, they landed up with lots of misunderstanding and lack of knowledge. In this scenario, only verbal discussions with the patient are very difficult by the patients to retain, specifically because we discuss all the radiation process and the immobilization devices of the patient, and this actually creates anxiety among the patients. So educational materials do exist, but they are very generic and there are lots of misconceptions in that also. So the most widely available resources from ASTRO and NHS are primarily in English, and the region from where I belong, the primary language is Urdu, and no such video materials are available in that language. So the objective of our study is to evaluate that whether the radiotherapy specific educational video may improve the patient-reported knowledge or decreases the patient-reported anxiety or increases the patient satisfaction. So we develop a 3.5-minute Urdu language video at our center. This video is directed and produced by the student-led Tumor Board Establishment Facility Forum, and this was finalized and reviewed by the radiation oncologist. So this video has 4 major important components, including simulation, treatment, side effects, and follow-up. And the most important part is that this video scored 100% understandability and 100% actionability on PMAT AV video assessment tool. So our study is a phase 2 randomized controlled trial conducted at our center with the registered RCT number. The acronym we gave to our study is CARE-RT, and it includes around 100 patients who are Urdu speaking, radiation naive, and have a smartphone access. So they are randomized into 2 groups. One is the video group and the other is the verbal instruction group. The video group received the WhatsApp video regarding the radiation treatment process before the physician's consultation, and the verbal instruction group received only the standard physician consultation. So these are the broadly our 2 groups. So the outcomes were assessed on pre-consultation survey, in which we evaluate the baseline knowledge, expectation, anxiety, and fear. And after and the post-consultation survey, we evaluated the understanding, treatment confidence, and satisfaction of the patient. And these responses were recorded on the 5-point Likert scale. So coming to the results, the 100 patients were almost equally balanced among the 2 arms, and the major site was head and neck tumor. The primary concern of both the patients were regarding the long-term cure and prognosis and the treatment delays and side effects. So when baseline knowledge was assessed, it was poor in both the groups, with 50 to 60% of the patients reported that they are not at all confident about the radiation treatment process, and the radiation side effects. However, there were moderate to higher anxiety among these patients, and there was a slight fear among these patients. So after the consultation, the overall visit satisfaction was high in both the groups. Around 80% of the patients were very satisfied with the consultation, and but there was significantly higher efficiency reported in the video arm with a significant p-value. When the video subgroup was evaluated, most of the patient, around 80% of the patients, rated that they are very and extremely, that the video is very and extremely helpful. With 95% of the patients felt that it addressed all their questions related to the radiation. This all decreases the anxiety in 70% of the patients. Additionally, non-video group expressed the need of additional information. Around 60% of the patient felt that if they have shown the video related specifically to the side effects and the daily treatment process, it will be much more helpful. So the strength of our study includes that it is a randomized phase 2 trial, specifically designed in the Urdu language and validated with a good highest score on the PMED AV assessment tool. Limitations include this is a single center study with short-term outcomes, and anxiety and knowledge were assessed on 3-point Likert scale. So in conclusion, the baseline knowledge was poor in both the groups with moderate to high anxiety, but the short video reduces the anxiety and improves the overall efficiency of the consultation. So this is a feasible low-cost strategy that can enhance the patient understanding. So we advocate to introduce the language-specific videos in radiation daily outflow. So this is our team. I'm now quoting the words of Andrew that if you want to go fast, you go alone. And if you're going to go long, you have to build a team. So this is our team. And we conducted this randomized trial with no cost, with $0 investment. And that is why the study is important. This is our center. Thank you.
Thank you, Dr. Yumna, for